Hey there, I'm Dr. G. I'm an integrative and functional medicine doctor. Let's talk about one of the most underrated minerals in the body, magnesium. And probably I sound like a broken record because I am always talking about this with my patients. So, most people don't realize that they're deficient until we fix it, and suddenly they have more energy, they're sleeping better, they have less headaches, they're feeling more like calm and relaxed. So, if you're someone who's been feeling a little weird or kind of off lately, I want to walk you through 10 surprising signs that I've seen in my patients that may suggest you need more magnesium that you're getting in your diet. So let's get started. So, number one is fatigue. And it's fatigue that doesn't really go away. So, it's like you're tired all the time, but you're having a full night's sleep and you have a pretty good diet. Low magnesium could actually be the reason for that. Magnesium is really important for ATP production. So, think like biochemistry, like you need the ATP inside your mitochondria. And in order to produce that, we do need a good amount of magnesium. So without it, your body literally cannot generate energy efficiently. So people will describe this like, I'm drained by noon, or my battery is drained by noon, or I have this like weird wired and tired feeling. And it's often a mitochondrial issue that can start with magnesium. And you may need other things, but magnesium is a really good place to start. Number two is going to be like muscle twitching, cramping, restless leg. Do you ever get like a twitch in your eyelid or like a foot cramp in the middle of the night? That could be that your nerves are misfiring. So, magnesium actually helps regulate how calcium enters your nerve cells. When you don't have enough of it, the cells can get overexcited, which can cause like this twitching and cramping and like that weird restless leg syndrome at night. This is super common in athletes, people who are on diuretics, and I see it a lot in my patients experiencing PMS. So let's go to number three. This is probably the most favorite one, and I always love to talk to my patients about this. This could be craving chocolate. So if you're craving chocolate, that could mean that you're actually deficient in magnesium. Dark chocolate has one of the highest levels of magnesium that you could find in the chocolate family. Just 1 ounce, which is a really small amount of dark chocolate, actually has 65 milligrams of magnesium. So if you're craving it, and especially during your period or right before your period or during stressful times, that could be a clue that you are low in magnesium. What's really cool is the American College of Gynecology actually recommends magnesium as a supplement, and they don't recommend a lot of supplements that can actually help with PMS. Some things that can lower your magnesium, PMS is one of them, or menstruation, and also if you're drinking too much coffee, that can lower your magnesium levels. And when we're thinking about PMS and we're thinking about mood symptoms, magnesium is also important for supporting serotonin, which is like the happy chemical that antidepressants work on to boost your mood. If you don't have enough of that, that can create more of those like emotional mood swing type feelings. And number four is trouble falling asleep or even staying asleep. Again, we're talking about that weird, wired, tired feeling where your body is like exhausted, but your brain just like won't stop spinning. That's a classic sign of magnesium deficiency. How it works is when you think about magnesium, it helps support GABA. And if you think about GABA, it's a neurotransmitter that is in your brain and it helps to calm down your brain and helps you to stay asleep. Magnesium is also important for regulating cortisol spikes. So, cortisol is a hormone that we need to be alive. If you don't have cortisol, you die. But you want it to come the highest in the morning time and kind of taper off and be lowest at night so that you can fall asleep. But sometimes people will wake up in the middle of the night, like 2 a.m., and their mind is racing and they feel kind of anxious. And magnesium can be one of the things that I recommend that can be really helpful to kind of calm these things down. And kind of tying into that is when I think about anxiety, irritability, mood swings, whether it's related to a period or not. Magnesium is like I think about it as nature's like anti-anxiety medication. And if anybody's on anti-anxiety medication and they're not on magnesium, you're missing out on this opportunity to help balance and calm your nervous system in a natural way. So how I like to think about it is we have this HPA axis that's is our brain telling the rest of our organs that make hormones, and it supports all these different levels. And so magnesium helps to kind of balance that out. So we're creating calm, we're creating good amount of serotonin release, good amount of dopamine release. When you have not enough magnesium, you can feel like you're constantly on edge, like you're constantly overwhelmed, you're having mood swings. And the mood swings will seem kind of like out of proportion to the environment. Like they don't really make sense for what's going on. They've actually studied this in clinical trials where they looked at patients who had mild to moderate depression and anxiety. And even if they didn't have a clinical diagnosis, they saw a significant benefit from taking magnesium. And number six is probably a common one that you've heard before. It's constipation or even infrequent bowel movements. So for my patients, I tell them, I want you to be having a bowel movement every day. If you're having a bowel movement every day, it suggests that your microbiome is healthy, that your body is healthy, that you're eliminating waste well. And if patients are not going to the bathroom every day, I'll usually recommend magnesium. Usually magnesium citrate, because it'll help you start at a low dose, you kind of build it up till we get to our target of one bowel movement a day. What it does is it helps relax the muscles of your bowel that may be really tight, especially if you're anxious and kind of wound up. And it also helps to pull water into the intestine, which helps to move the bowel movements along. And number seven is frequent migraines or headaches. So this is probably out of all these things, the most well-studied use of magnesium. So when we think about studies that they've done, studies have shown that in patients with migraines, a dose of just 400 to 600 milligrams per day can reduce both the frequency and the severity of migraines. That's huge. That's amazing. This is not a medication that can cause other side effects. It's a supplement that may actually benefit all these other areas of your life and potentially improve your migraines. Or it may suggest that if you don't have enough magnesium, migraines could just be a side effect of that, and you could be curing that. Number eight is going to be heart palpitations or irregular heartbeat. So when you think of that like weird little fluttering sensation, magnesium can be really helpful for that. And what's interesting, when I think about how we take care of patients in the hospital, if we're looking at their EKG and we're seeing a lot of these like irregular beats called PVCs or APCs, a lot of times we'll check both the potassium level and the magnesium level. And we'll want to replete or put back the minerals that the patient needs to help calm the nervous system. Just like the nerves twitching in your eyelid from being twitching, the same thing can happen in your heart and create these like irregular heartbeats. So having enough magnesium can also help to decrease those weird little flutter sensations. A note on that, or people who are most at risk for having this type of reaction or not having enough magnesium, are people who are on diuretics because you're peeing out the magnesium, athletes who are sweating a lot and not getting enough electrolytes back, and those who are under chronic stress, because our bodies, when we're under chronic stress, require higher levels of minerals and vitamins to support all the processes. Obviously, if you're having weird heartbeats and it's not really going away, you should get that checked out by a doctor. But this may be something else that may be correlated to a low magnesium level. Number nine is kind of weird and interesting. And I think to me, this goes along with when I think about migraine. So sometimes if you have a low magnesium level, you can actually have sensitivity to noise and light and crowds. And this one's weird. This is like where you're suddenly overwhelmed by there's too many people in the room, or you go into a room and it feels too bright and the sounds are too loud, or you just want to like close the curtains or sit in the dark. It may be related to magnesium. And we think about that like hyperactivity that magnesium helps to calm down. Magnesium also can be helpful to support your nervous system in filtering out the extra stimulation. This can be extra important in somebody who has ADHD, where they're not able to well enough sort out that extra stimulation. Think about it this way, if you have low levels, you can have a low tolerance to loud noises and too much stimulation. And like we said, ADHD, anxiety, or even people who have had a concussion, we can sometimes see these symptoms. And number 10, not as exciting as that, but it's numbness, tingling, pins and needles. So when people think about numbness and tingling, a lot of time we'll think about B12. You can also think about copper. You can also, when you're getting that weird feeling in your legs, that restless leg, could also be iron or ferritin. But if all of those things are normal and you still haven't quite pinpointed and you don't have diabetes and diabetic neuropathy, magnesium may actually be the missing link. As you can see here, magnesium is super important for nerve conduction, for electrolyte balance. And the common kind of denominator here is we're starting to see nerve hyperactivity or weird nerve symptoms around not having enough magnesium. And you may have diabetic neuropathy, and that may be contributing to your neuropathy in your feet, but diabetics are often more at risk for low magnesium, and magnesium has actually been shown to improve insulin sensitivity in patients with diabetes. So there you have it, 10 sneaky signs that your body may be calling out to you, telling you that it needs more magnesium. So if this resonated with you and you feel like this applies to you, some foods that you can eat to improve your magnesium levels are pumpkin seeds, spinach, almonds, avocado, and then our favorite dark chocolate, just an ounce, getting 65 milligrams of magnesium. And most people will benefit from a supplement, but it's really individualized and there's different kind of nuances that help me decide which supplement will be beneficial for each patient. And I'm going to make a video on that. If you're interested, please comment down below. Like, share, and subscribe this with somebody who might be magnesium depleted and not even know it. Thanks for watching.